Health Minister Shane Reti has conceded it may take years to get the public health system out of its current state, which he's labelled a crisis. Here's Jenna Lynch.
Impressed by a shiny new X-ray, but it can't mask the health system's decay.
Look, it shows there's challenges across the system. I said coming into in opposition that it was in crisis. I'd say to you today that it's still in crisis.
The Health Minister unveiled the new diagnostic tool at Wellington Hospital today, but diagnosing is one thing, treating is another.
When's the crisis going to be over?
Yeah, so to do that we're going to need a plan, which is what the workforce plan will come up with, and then we're going to need to appropriate the funding towards that plan.
That doesn't sound like fast work.
What I would say is it's not going to be any time immediately. This will be challenging for some period of time. That's likely to be months rather than weeks for sure.
Yes?
Look, I can't tell that. It's really challenging.
In the meantime, patients are being let down.
They couldn't care less.
When George Mulholland first discovered his skin cancer, it was a 2mm mark.
9 months later down the track, nothing's happened. Forgotten about it, just pushed out.
It's now 45mm.
Where's the public health system? Where's it got to?
It was diagnosed as a squamous cell carcinoma in November. George was referred to Burwood and Christchurch for treatment. He was told he'd be operated on by April and heard nothing. It wasn't till his son, patient advocate Malcolm Mulholland, visited him on the West Coast earlier this month that they learned he'd need to keep waiting.
I made the call to Burwood and said, where is Dad on that waiting list? They said basically go private. He probably won't be seen this side of Christmas.
If you want any action, you've got to go private. Well, at my age, I'm on a pension. Money doesn't come easy.
Today, post his surgery, in which he had 10 skin cancers operated on, a letter arrived. Burwood had finally booked him in on the 5th of September.
Public dermatology service has got a big problem. It's very under-resourced.
Dermatologist Dr Scott Barker says increasingly he's seeing people in his private practice travelling from across the country for treatment.
I think in the centres where there is a service, there's invariably a waiting list, and if there's no waiting list, it's because there's no service.
The recommended dermatologist to population ratio is 1 to 80,000.
We have public provision of about 1 to every 300,000, and that's in the setting of a country that has a very high skin cancer rate.
Health New Zealand Canterbury's Chief Medical Officer told us that the most urgent cases are seen within 31 days. The target for the rest is to be seen within 4 months of referral, but the wait list at Burwood is 7 to 8 months long. He said of the 306 patients who've waited longer than 4 months, 266 of them have been booked for an appointment.
You're only a number to them. You're not a person. You're only a number.
Dr Barker is urging patients to get back in touch with a health professional if their skin lesions change while they wait for treatment, as that may determine the urgency on the wait list.